Hello and welcome. I'm your host, Neil Howard. Thank you so much for returning for another segment of Health Professional Radio. We'll be speaking with Claude Royster, VP and GM of Healthcare Select Specialties, Health and Wellness at Synchrony. He's joining us here on Health Professional Radio to discuss recent research that reveals that more than 1/3 of orthopedists are experiencing burnout. Welcome to Health Professional Radio, Claude Royster. Thank you so much for taking the time with us.
Thanks, Neil. It's an honor to be here.
Well, tell us a bit about yourself, Synchrony Health and Wellness, and then let's talk about this rise in burnout among orthopedic physicians and surgeons.
Absolutely. Again, my name is Claude Royster. I am based out of the Chicago market, and I have the responsibilities of overseeing our healthcare specialty market. So if you think about our specialized physicians, whether it's orthopedists, podiatrists, pediatricians, OBGYN, I focus on those specialized physician groups and develop growth strategies and execution for those markets. I've been with CareCredit for now 4 years. I've been with Synchrony for 10 years, and I've been in the consumer finance or the financing space for over 32 years.
We've all heard of burnout. We've especially heard about burnout during the height of the pandemic with many frontline workers just saying, I give up, I can't deal with this. How troubling is this trend?
It is really a very interesting trend that we've seen. And the sad truth is there's burnout crisis amongst all medical professionals. Mm-hmm. Orthopedists really aren't an exception to that. In fact, in 2022, the U.S. Surgeon General released an advisory on addressing a health worker burnout. We've seen some literary studies on burnout among orthopedists reported by a company called Helio, which revealed that 40 to 60% of the orthopedists are experiencing episodes of burnout. And that is rapidly increasing, and it's rapidly concerning because of the demand of orthopedic specialists that are increasing amongst the patients.
Are we talking clinical burnout, real burnout, or just one day is not as good as the last day? Every profession, especially medical professionals, have their ups and downs. When can we call this a burnout situation and be concerned about a person either wanting to leave the profession, slow down, or change to another specialty?
Sure. This is definitely clinical burnout as we have seen this. And as you can imagine, during the pandemic, unfortunately, there were many cases where some of these elective procedures were not able to be serviced because of the pandemic situation. And, once that started to lift and they were starting to do more of these procedures in the practice, demand was high. There were a lot of people who needed care during the pandemic that weren't able to get care. And unfortunately, there were people that accumulated certain medical needs that weren't being addressed. So the reality of it is it put a heavy strain on the healthcare system, and orthopedists are no different. Having to schedule those appointments out in advance, having to perform procedures or surgeries, X amount a day. It put a lot of tremendous strain on not only the physicians, but the workers that work in the practice in terms of scheduling, making sure that their facilities were clean and met the standards, post-COVID. All of those things basically attributed to the burnout that we have seen recently in the healthcare space.
Many of the protocols that were put in place during COVID still remain in many hospitals and clinics today, even though the fear of COVID and the possibility of contracting COVID has kind of died down. What are some of the contributing factors to burnout now that things are back to some level of normal?
Yeah, there's a few things that contribute to that. Number one, there's a lot of bureaucratic tasks that are related to the orthopedist. The lack of computerization within the medical practice has also contributed, as well as insufficient compensation and reimbursement. They're working a lot longer hours. But I can't really speak to the compensation and the computerization, but what I can speak to are the bureaucratic tasks that are affecting the burnout of orthopedists. So orthopedists, like all healthcare providers, don't spend their time doing administrative tasks. They want to be engaging with the patients, understanding what their diagnosis is, and use their qualifications to provide quality healthcare. One of the areas that does demand a lot of time from healthcare providers and their teams is the revenue cycle management, which includes the billing and collections for patient services. That's very complex, and it's unpredictable just given the nature of what insurance will and will not cover and the reimbursements. And that leads to a lot of overload work for the providers and having to follow up with insurance companies to ensure that they're getting paid, making sure that they're putting in the right codes to ensure that payments are made expeditiously. But all of those things considered, they generate a lot of stress on the healthcare system. And, CareCredit, we actually did a sponsored survey with CWH Advisors entitled Patient Pay 2022, and we found that 63% of the healthcare provider respondents were experiencing staffing shortages in their revenue cycle departments, and those vacancies are very difficult to fill. There's a lot of demand and people moving around and people stressed and leaving work, which can lead to unpredictability in the revenue streams and disruption in the overall operation.
I can remember when it was the norm to sit with a doctor for 30 minutes, talk about what was going on, very casually, and then he would have someone else do dictating, things of that nature. But over the years, more responsibility for administrative work has been put on the physician. For what reason? Reasons vary, but it would seem that they need more people to help, more people on the team, as opposed to these, cutting down on the people that used to do some of this work, to let the physicians be physicians.
Absolutely. And, one of the things that will impact that, again, is the integration of working with different platforms or softwares that can help them with, their appointment setting, whether it's the patient records or the EMR systems. That's going to create some efficiencies for the business and allow them to be able to expedite those services to the patients. So very important that they continue down the path of technology. And in many ways, we can help support that from a patient financing perspective by working with some of these technical partners where patient financing does become a solution for patients that are out seeking care.
Are there any cultural factors that contribute to burnout among healthcare professionals? We've seen quite a bit of activity when it comes to making sure that diversity, making sure that people understand cultures that aren't their own.
Yeah. So, obviously there is clearly some disparity in health and access to healthcare. So, one of the most important things is continuing to educate the patient on having access to be able to get the care that they need, whether that's through patient financing or other means, whether that's through CareCredit and CareCredit credit card or other products that are out there, or maybe it's even in-house financing that the provider can have. But I think part of that is education and making sure that patients have access to care and understand the options that they have as it relates to a service or diagnosis that they need to be treated.
And give us a website where our listeners can learn more about Synchrony and CareCredit.
Sure. They can visit us at our website at carecredit.com/providers. That will provide a lot of information on the various industries that we currently serve, our suite of products and services that we offer. And it also will provide links if there's any questions on how to enroll and become part of our network. All of that information is housed on that website.
Claude, I appreciate you joining us here on Health Professional Radio. I'm looking forward to another conversation with you as soon as possible.
Thank you, Neil. It's been a pleasure. I appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Claude Royster. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.